Hi, I want to discuss lab testing after weight loss surgery. Lab testing after weight loss surgery is something that I see is not done effectively by almost any internist or any primary care doc out there. If that primary care doc worked at a weight loss surgery program in the past, if they learned a lot about weight loss surgery in their training, they might check the correct labs. If they are a weight loss specific doctor, they've done a fellowship in weight loss, they might check the appropriate labs. But all of the other guys, they're not going to do it. Even an endocrinologist, they generally won't do it. So, what are the labs that you need to have checked? Okay, I'll go over a few of them, the main ones. Okay. And you need to have these checked really every year to every other year minimum to be safe. One of them is iron. Iron is absorbed in the upper part of your intestine primarily. When you have a gastric bypass, that portion of the intestine is bypassed. Okay, so iron is not being absorbed there. Iron is still absorbed further downstream. However, it's not absorbed as well. This is why a lot of weight loss surgery programs will recommend taking supplemental iron. Nevertheless, you should be having your iron level measured on an annual basis. Now, if you've had a gastric sleeve, you're not out of the woods. When somebody's had a gastric sleeve, the food goes through the stomach quite quickly. After the sleeve is healed and 6 to 12 months out, what we find is that food actually goes through a sleeved stomach more rapidly than it does a normal shaped stomach. So when it does that, it goes off into your intestine very quickly and is not absorbed as well as it is under normal circumstances. So although low iron is not as common after a gastric sleeve, it does occur. So even if you've had a gastric sleeve, you should have your iron checked on an annual basis. Okay, then there's calcium. Calcium is also absorbed in the upper intestine. Calcium absorption is also dependent on vitamin D. Okay. So you need to have enough vitamin D to have enough calcium. When your doctor checks your calcium level, it's not enough to say your calcium is in the normal range. And it's also not enough to say if your calcium is a little bit low, you better take more calcium. They need to check the vitamin D as well. Vitamin D is absorbed way down in your intestines. So you will absorb vitamin D appropriately after a bypass and after a sleeve, as long as you eat enough healthy food. Now, many people have a low vitamin D even without having surgery, incidentally. So, low vitamin D is fairly common in our society. So just because you have a low vitamin D doesn't mean it was from surgery. And just because you're eating enough normal, healthy foods doesn't mean your vitamin D level is going to be high enough. So vitamin D does affect absorption of calcium. So you should have both your calcium level and your vitamin D level measured on an annual basis after gastric sleeve surgery or after gastric bypass surgery. You maintain a lot of calcium in your bones. That's a primary storage site for calcium in your body. Once you have low calcium, you've really depleted your bone supply of that calcium. So you're going to need to be taking calcium for quite a while afterwards. You'll need to take vitamin D and possibly medications that dramatically increase deposition of calcium in your bones and absorption of calcium from your food so that you actually replenish the calcium in your muscles. In your bones. Now, what are the other effects of calcium? Calcium has one very significant effect when it comes to weight loss, in my opinion, and that is metabolism. Your muscles don't fire normally unless you have calcium stores that are normal within the muscle cells. So when you have low vitamin D and low calcium, it's most likely that your decrease in calcium also has affected the calcium in your muscles. Now, I'll give you an example of calcium in a muscle that was dramatic to see. When the calcium was low, the muscle didn't fire at all, and the patient was going to die. And we had to give them a lot of calcium in order to keep them alive during the period of time when they had low calcium. And this was in the intensive care unit, somebody that was in heart failure. The heart requires enough calcium to be able to squeeze effectively. And this person had a disease process which dramatically, over a short period of time, decreased their calcium. They were going into heart failure. I was told by the intensive care unit doctors, there's nothing you can do. This patient's going to die. So what I did was I gave the patient a big injection of calcium chloride, which is the way calcium is given intravenously in the hospital. And when we did that, the patient's calcium went up and their heart remarkably started squeezing much better. Their blood pressure went up and they stayed alive. And it turned out I had to give big doses of calcium every half hour for approximately the next 12 hours just to keep that person alive. The intensive care unit docs thought I was nuts. The pharmacist called me up and said, "Why are you doing this?" But the reality is I gave this person big doses of calcium for about 12 hours. The heart continued to squeeze effectively until it got out of that specific process that was going along, and their calcium was able to stay at a healthy level. So that's a dramatic example of how low calcium can decrease your muscle strength and your muscle function. Okay, so you should have your calcium checked, your iron checked, and your vitamin D checked on an annual basis. Okay, vitamin B12. Vitamin B12 is absorbed further downstream in your intestine. However, vitamin B12 requires something called intrinsic factor. Intrinsic factor. That's created by the upper part of your stomach. Incidentally, when you have a gastric sleeve, this portion of your stomach is removed. I don't do regular gastric sleeves anymore. I do my Slim's gastric sleeve, which is a reversible gastric sleeve, and you don't remove any stomach. And partly I do this because I don't want to cause the decrease in intrinsic factor. When you have a decrease in intrinsic factor, you're more susceptible to having a decreased vitamin B12 because intrinsic factor is required for absorption of vitamin B12. So anybody who's had a sleeve needs to have their vitamin B12 evaluated every year, at least, in order to make sure their vitamin B12 is at a normal level. If your vitamin B12 goes down, what are the complications of that? Well, you can get anemic. So your hemoglobin level goes down, you feel weak and tired more often. You can also get multiple neurologic complications, including brain damage, nerve damage, damage to your muscle firing because of peripheral nerves, meaning the nerves that go to your muscles that help you breathe, muscles that help you move, and you'll be weaker as a result. So that can happen with vitamin B12. So the anemia, the brain damage, the weakness, and there are a whole host of other things that can cause or that can happen due to vitamin B12 being low. A couple of other things need to be checked. Your thiamine level, which is vitamin B1, and your vitamin B2 level, and also your vitamin B6 level. These things need to be checked at least every other year. And I've never seen a time when primary care docs have ordered these labs in my patients. So make sure you get those checked as well. The B vitamins have a significant effect on your nerve system, your neurologic status. So they can affect your memory. They can affect your vision. They can cause weakness. If they get low enough, they can actually result in coma. Those vitamins are also active in metabolic processes like modulation of cholesterol and triglycerides. So you really need to have a normal level of those as well. You need to have your hemoglobin checked, but every doctor will check that on an annual basis. You need to have your liver enzymes checked. These are proteins that are produced by the liver to make sure your liver is functioning normally. And you need to have your what they call your lipid panel. Your cholesterol and triglycerides need to be checked. So all these things need to be checked. So I'll run through it one more time. Your calcium, your iron, your vitamin D, your vitamin B12, B1, B2, B6, your lipid panel or cholesterol panel, your liver function tests, your hemoglobin. All those things need to be checked every year or every 2 years after weight loss surgery. This is important. I hope you paid attention. You can go back and listen to this again and write these down. There are other things that are recommended by the Bariatric Society, but this is the minimum that needs to be checked on a regular basis. All right, folks, I hope this helps you. Have a great day.